My name is Fredalyn Menard. Most people call me Freddy. I am a cancer screening nurse navigator at Nanticoke Cancer Center. Most people know someone, either a friend, a family member, a neighbor, a church member with cancer. Nobody can tell me that they don't know anybody that has been diagnosed or know somebody who's going through cancer. We can screen for breast cancer, we can have a mammogram, and we can also screen for cervical cancer by having a PAP. We can also screen for colon cancer by having colonoscopy. And prostate cancer, we check for the PSA. And now the new thing, we have new guideline. We can screen people for lung cancer. So for the lung cancer, there is a lot, you have to be a smoker, 15 years. However, it's a very good thing because now the goal is to find out early, because the early stage, the early detection is better. So mammogram is very important for women. So it's recommended by the American Cancer Society to have, for women age 40, to start having a mammogram every year or every 2 years. However, if women have risk family who has breast cancer, like a mother, aunt, cousin, so sister, so we recommend this woman to talk to the primary physician, so then their primary physician can decide what is better, what is best for them. When people between the age of 18 to 39, we also encourage them to have clinical self-breast exam. That is very important because a lot of time, women, they find the lump themselves. And one thing we have to remember, breast cancer does not only affect women, breast cancer also affected men. 2 weeks ago, I had a young man, only 18 years old, and he found a mass. So they had a mammogram for him, and then they did a biopsy. So right now we're waiting for the result of the biopsy. So it's very important because to encourage men and women to know what's going on in your body, because we know our body better than anybody else. So we have the screening tools there for women. Men doesn't go ahead and have a mammogram unless they have something like the young man I talked about who had fell a lump, and then they took him to the doctor, and then they decided that the best way is to have a mammogram. So cervical cancer, the percentile of cervical cancer, it's going up, especially in Delaware. For some unknown reason, women having the mammogram, but they're not having the PAP. So my goal as a cancer screening nurse navigator is to make sure that these women, so I have a lot of referrals from the primary physician, the NPN network. So I receive referrals every day. So just last month, I received about 75 referrals. And I was very excited. From the 75, 55 of them were screened. And then the rest of them, that doesn't mean they will not be screened, but I'm gonna follow up with them. Because we work, we have to take care of families. Sometimes people, they just need a little push. So that's why I'm here. That's why my job comes to play, I called, I send reminders. I do whatever it takes, and I don't give up on these people. I have people that I send a reminder like in January. They might call me back in November, but that's okay. I keep calling, I keep sending reminders, because the goal is to have this screening, and the goal is the earlier we catch the cancer, the better. Early detection is very important. For example, if somebody just diagnosed with breast cancer stage 1 or stage 2, there's more treatment. The earlier we found the cancer, the better. People in general, we're scared. People don't want to have a colonoscopy. People don't have a mammogram because they're like, I don't want to know. It's better to know, because the key is the early we found the cancer, we can treat it better. Better outcome, that's the key. Now with the 3D technology, it really helps us with early detection. If you want more information about cancer screening, please call me at 302 629-6611, extension 3765. I'm here Monday through Friday from 8 to 4:30.